Psychoanalysis and philosophy, essential and comprehensive knowledge, psychoanalysis, CBT, Istdp, spirituality. We had seen before, one session we had before on essential and comprehensive knowledge. We took an overview of what it is, and today we will apply it in a specific sense, more focused, slightly deeper to psychoanalysis, CBT, Istdp, and spirituality. Let us first revise what essential and comprehensive knowledge is. Comprehensive knowledge is specific knowledge. Essential knowledge is fundamental knowledge. Comprehensive knowledge is knowledge of specifics and facts. Essential knowledge is knowledge of principles, generic principles. For example, as a part of comprehensive knowledge, I can say water boils at X degree, petrol boils at Y degree, glucose boils at Z degree. Specific knowledge, scientific knowledge. From these three principles, three facts, I can deduce a principle: liquid boils when heated. This is essential knowledge. This is inferred. This is not seen. It's an intuitive, spontaneous generalization from a set of facts that I have. We are moving from specific to the general. Immanuel Kant, in his critique of pure reason, says that human mind is so hardwired that we cannot be content with only comprehensive knowledge. We intuitively and spontaneously move towards essential knowledge. Comprehensive knowledge is something which works in the world. To do anything, we require comprehensive knowledge. Essential knowledge is good for philosophical understanding, scientific understanding, conceptual, mathematical understanding. It is something that our mind craves for, but with essential knowledge, we can't move anything in this world. And yet, we spontaneously, of our own accord, yearn for, search for, and move towards essential knowledge. In psychoanalysis, we have application of both. A set of knowledge in psychoanalysis is essential knowledge. Another set of knowledge in psychoanalysis is comprehensive knowledge. Metapsychology is essential knowledge. Phenomenological knowledge is comprehensive knowledge. Let us take up in psychoanalysis essential knowledge and comprehensive knowledge. If we take up the drive frustration schools, let's say we take up Freudian school. If we take up Freudian school, the core principle will be drive frustration leads to pathology. This is a fundamental principle, essential knowledge. So whether it is anal fixation problem or Oedipal fixation problem or oral problem, in all cases, drive frustration is involved. So essential knowledge is drive frustration leads to pathology, or drive frustration can lead to pathology. But if a person is suffering from an Oedipal entanglement, it is drive frustration but of a particular type, and therefore we say the person has an Oedipal problem, which is comprehensive knowledge. Every Oedipal problem is a drive frustration problem, no doubt about it. But unless we specify, we can't do anything in therapy. So to do something, we require comprehensive knowledge. Without it, we cannot have a specific pathogenesis and a specific treatment plan and a way of doing therapy. We can only have a philosophical understanding, a metapsychological understanding, which is not good, any good for practice. So The point that dry frustration can lead to pathology is essential knowledge. Oedipal entanglement has led somebody to pathology is comprehensive knowledge. Come to the Kleinian school. Object loss can lead to pathology, essential knowledge. Object loss is of various types. One particular type of object loss is abandonment. And we say person X is suffering from a problem of abandonment. This is comprehensive knowledge. Take the Cohesion school. Unhealthy self-creation can lead to pathology, essential knowledge. But unhealthy self can be of various types. It can be psychotic unhealthy self, borderline unhealthy self, or narcissistic unhealthy self. So if we say narcissistic unhealthy self-creation or narcissism has led to pathology, this is comprehensive knowledge. So in this way, we can see in every school of psychoanalysis, there is a set of essential knowledge and there is a set of comprehensive knowledge. In CBT, it is believed 3 core beliefs can lead to pathology. And these 3 core beliefs are helplessness, worthlessness, and unlovability. So this essentially is essential knowledge. CBT is essentially based upon essential knowledge. That ultimately you essentialize from the whole DSM, 18 chapter out of 22 chapters of DSM, 4 are very biologically driven. 18 chapters of DSM where psychotherapy can do something. If you look at all the pathologies described there, they will all converge into these 3. They have to fall into these 3 in terms of causality if you practice CBT. So every pathology, let me specify, every psychopathology which can be dealt with by psychotherapy, essentially therefore is an outcome of these 3 core beliefs according to CBT. So it's a very essentially driven psychotherapy school. It does not go into various types of helplessness, various types of worthlessness, but it essentially essentializes hundreds of specifics, essentializes into the 3. So it's a very essential knowledge driven school. On the cognitive side, Istdp is the counterpart of CBT on the affective side. Istdp believes that there are 3 essential things which are repressed in the unconscious mind which are responsible for psychopathology. It is unconscious rage, unconscious grief, and unconscious guilt. So like CBT, all pathologies have to ultimately converge in terms of causality in these 3 categories: rage, grief, and guilt. Spirituality, so Istdp is a very essential knowledge driven system. It's a mirror image of CBT. CBT is essential knowledge driven on the cognitive side. Istdp is essential knowledge driven on the affective side. Spirituality also is essentially driven, where it talks about desire, attachment, and aversion. So ultimately all problems come down to problems of desire. And if you want to be slightly more specific, you go into attachment and aversion. So psychoanalysis has both essential knowledge and comprehensive knowledge, whereas CBT, Istdp, and spirituality are essential knowledge driven. They ultimately move from the comprehensive to the essential, and there in the essential they try to solve the problem. Essential and comprehensive knowledge, when and how it works. What works when and how. Essential knowledge works very well when a person who does not know what he is suffering from, at least in essential terms, knows what he is suffering from. In specific terms, if he knows, it's even better, but he may not be ready. So when you are not ready for specificity, but you're ready for generality, essential knowledge is very useful. It reduces the infinite, the anxiety about the infinite into a finite problem, and the person also realizes what he is suffering from. Many suffer from, he belongs to a community. The person also realizes in a non-pathological way what he is suffering from in smaller quantities is present in every normal person. Again, he feels more normalized. Essential knowledge helps in essential logical thinking and facilitates moving towards the specific, or helps evaluating the specific. So thinking in essential terms also helps us at times not only generate more essential knowledge, but at times even generate more specific knowledge. Comprehensive knowledge, of course, is very important in this world. Anything you want to do, you need comprehensive knowledge. In the classroom, essential knowledge may be fine. In the research laboratory, may be fine. In writing or debates, it may be fine. But to do something in this world, you require comprehensive knowledge. It provides a clear cause and effect relationship, which the patient and the therapist and any researcher can benefit from. Problem being clear, the search for solution becomes clear. Reading about the problem can be given as a part of self-work to the patient, and it helps tremendously. Very well used in CBT, not so well used in Istdp and psychoanalysis. Provides tools for therapy. And healing comes at the end with comprehensive knowledge. Even in case of essential knowledge-driven schools, at the end, it is the comprehensive knowledge of something which is troubling the person, which comes to the forefront, and the effect related to it also comes to the forefront, and the fundamental restructuring takes place. So psychoanalysis has both essential and comprehensive part, but essentially it is given it is a comprehensive school. If you look in terms of what predominates psychoanalysis. CBT is essentially driven. Istdp is an essentially driven school. It essentially tries to essentialize psychoanalysis. Istdp is essentializing psychoanalysis. However, Istdp has realized in its journey that it is not possible to be a theoretical, school agnostic and yet do affect work. First, they realized while dealing with fragile patients that if the split is open, you cannot really do Istdp work. And split is a Kleinian concept. So the moment you try to deal with the split, you are bringing in the Kleinian school. You are no longer an essential school. You have brought in a comprehensive element. Similarly, the fragility calls for safety. And it calls for a holding environment, which is a cohesion concept. So the moment you talk about safety, you are bringing in cohood. When you talk of self-deficit, you are bringing in cohood. So Istdp today is no longer an essential discipline, although they refuse to believe it. Schools are coming into Istdp. Psychoanalytic schools are coming into Istdp, and they are realizing that there is no way you can say goodbye to the schools, be school agnostic, and yet do affect work. So the comprehensive is coming into essential model of Istdp, and it's a very good thing that there is a synthesis of the essential and comprehensive. What is happening is, like in case of hypnotherapy, where they created a state of trance, and in that state, they use tools from all the schools. Istdp today is essentially creating the state and regulating anxiety while bringing in tools from all the schools of psychoanalysis, without giving credit to the schools of psychoanalysis, unfortunately so. Spirituality has both essential and comprehensive elements. They start with the essential and then ask you to analyze the comprehensive in terms of the essential, and then repeatedly realize the validity of the essential, and then take essential directly to the comprehensive. What is the future like? There are two ways. Either essential schools like CBT and Istdp, the best parts of them can be taken by schools of psychoanalysis and merged, and they enrich themselves, like a Freudian school bringing in elements of Istdp, Kleinian school bringing in elements of Istdp, Both of them also bringing in elements of CBT and enriching themselves with Istdp and CBT, which are essential schools. So a comprehensive school can enrich itself by incorporating essential school, good parts of essential schools into them. That's one way to look at future. Second way is essential schools bring in good parts of comprehensive schools and enrich themselves. Istdp is doing it by enriching itself with all schools of psychoanalysis, good parts of all schools of psychoanalysis. What should happen, or should we create a third model where both are put together in a slightly different way? This calls for research into efficacy of both parts. Comprehensive going to essential, essential going to comprehensive, a third model incorporating both. Unless we have research, we can't really make a prediction which is more effective, but it's happening both ways, no doubt about it. So we need research to find out efficacy of what should merge into what, or if a third model should be created, what should be the nature of it. This also brings into question coming together of psychoanalysis and philosophy, because epistemology will have to be brought in as essential knowledge to be incorporated in comprehensive schools. And spirituality also will have to be brought in terms of its comprehensive techniques and essential techniques to enrich psychoanalysis. In the end, we are looking forward to a grand synthesis over the next 25 years. What form it will take, we yet have to wait patiently and find out. We will have inputs not only from these areas, but in that synthesis also from research in psychedelics, research in hypnosis, research in virtual reality. All this will come together to create a rich and grand synthesis and create a very powerful model of psychotherapy, and we will immensely enrich and benefit from this model, profit from this model as we go along. So the next 25 years are very exciting years as the synthesis takes place of essential knowledge, comprehensive knowledge, philosophy, spirituality, and technology. Thank you for being with me.